Welcome, everybody, to another episode of the Data Exchange podcast. I've got Peter Long again here from MCH Data, and we're going to approach this conversation a little bit differently. Last time we talked about your guys' educational data sets and how, you guys have pioneered that ecosystem over the last 100 years or more. And Peter, I think maybe we can start this one out with what got you guys into the healthcare market, and when did you start shifting some of your efforts over into this healthcare data market?
Yeah, well, thanks for having me on and having me back. We appreciate it. The healthcare sector obviously is very important. I think historically, you mentioned we're approaching our 100th anniversary in 2028. I'm a third generation, player. My grandfather started the business as a professor of education with a professional journal for teachers. And that subscriber list, started to power the first, school data company. But interestingly enough, my father was a famous cardiovascular surgeon. He actually put the first pacemaker in. If you go to our healthcare division website and kind of look in the history line, you'll see that he was friends with Earl Bakken, who was the founder and CEO of Medtronics. And he didn't put they were people that did the testing, or what do you want to call it, FDA approval process, that were doing some of this work ahead. So medical people may be like, well, but anyway, serial number one in terms of the actual commercially produced first pacemaker that came from Medtronics, my dad put in, and actually it only lasted 6 months. And so he had to take it out, and then he kept it, and he actually returned it to their museum and got, did a big talk and everything at Medtronics, which was the article that you sort of see in there. But he trained with DeBakey, Dr. DeBakey in Texas, who's a very famous cardiovascular surgeon, anybody that's kind of in that space. So, we had, my mom's was a head nurse at, the University of Chicago, health center back in the day. That's where they met. So we've got a history of healthcare in the family. My grandfather, who was running this business, realized that my dad was a great resource, and sort of picked up how to get, put medicine in as part of some of this process. So we started compiling healthcare in, I think, like 1958, somewhere around there. My dad put the pacemaker in 62, I believe, but, was a doctor, and my dad's passed away, quite a while. So, but, ultimately my dad did run the company for a little while after he retired from medicine, just about 4 years. So we are truly a third generation business, but he kind of, it wasn't his passion. Medicine was his passion. And so, I had worked at Coopers and Lybrand in the management consulting group for about 8 years out of Boston, came and, took the opportunity to step into this role back in the mid 1990s. So I've been doing this for quite a while, but yes, that's how we got into healthcare. So we've been doing that part for a long time too, and are pretty knowledgeable. And it's a huge sector, obviously. So
Yeah, well, let's kind of segue into that, right? It is a huge sector. Can you tell us a little bit about this market and what makes it so large?
yeah, well, I mean, obviously we all need healthcare, right? And so it's an industry that impacts every single person in America, and so, you can see the 5.3 trillion in spending. Most of that is obviously insurance payments for various types of things, but it makes up a large part of the gross domestic product. And there are very different segments of the market. There's the hospital market, there's the doctor office market, there's outpatient surgery centers and labs, dialysis centers. There's nursing homes, elder care. I mean, so, it is a very diverse, and it is, undergoing massive transformations over the last, 10 to 20 years. When you look at, private equity coming in and buying practices, when you look at hospital, conglomeration groups where there's a hospital and they're buying doctors' practices and offices along with elder care and hospice and lots of different things to sort of make, group purchasing type things. There's people in private practice, doctors that work for hospital, groups now, or, sort of going corporate, if you will. So it's a very rich, diverse, complex ecosystem. And once again, similar to education, it's everywhere in the United States. It's not a regional thing. It's not a niche thing. I mean, there is healthcare in every city, town, state, in America, and they just consume a lot. Once again, when you sort of look at a business, you look at the number of employees, but a hospital is really the number of beds, right? I mean, there are people in a hospital sometimes for weeks or months that are getting all kinds of treatments and this. And people in and out of doctors' offices. It's not really the doctor and the nurses in the office. It's all the patients that are rotating through that need gowns, this, slippers, procedures, all the different kinds of things that happen. So there's a lot of spending, a lot of activity, a lot of computer needs, everything you can think of. So yeah, it's a,
Wow.
a
You mentioned quite a few different verticals in the healthcare kind of ecosystem. Do your data sets span across most or all of those verticals?
Yeah, that's a great point. There's a lot of public information out there, and there are a lot of players in the space. There are a few mega players that do a very, very credible job, and they charge a very, very credible price too for what they do, which may or may not, be right up the wheelhouse of what everybody needs. I was like, do you need a Mack truck to drive your kids to school, or do you need a Toyota Corolla? So, the two major players in the industry are true Mack trucks. I mean, the amount of data and things that they have are staggering. And, they charge, their minimum, walk in the door price is six figures kind of things. Yeah, but there's a lot of people that just need, good data. And then you got to go to the other extreme, which is the public available information, the NPI file. There's a lot of information out there that you can get, but it's not collated together properly. It's not related. You don't have emails on there. You don't have a lot. So there's a lot missing. You need the public data to help join some things together. But, you know, per your question, what doctors work for what hospitals, what doctors are part of what group practice. You've got Dr. X, Y, and Z, but there's 7 doctors in this group practice that all sort of do the different things. And so the linkages, the relationships between, the doctors, and the hospitals, email addresses, contact information, programmatic digital. I will mention that in the healthcare space, programmatic digital advertising is massive. It's huge. It's definitely a big sector. They have realized, I mean, how you cannot go an hour on your phone or on your TV without getting some sort of ad for some sort of medicine, everything from toe fungus to whatever. But, so the healthcare providers and pharma industry and things have realized that the consumer can drive some of the demand by going in and asking the doctor for their GPL-1, stuff for weight loss or whatever. So, it's a very robust market and it's complicated, right? The
Yeah.
relationships is very complicated. You really want to go with a database that, sort of can guide you and understands this properly.
And if would it be safe to say that if I go to MCH, I can find chiropractors, orthopedic surgeons, any just different type of doctor?
Yeah, absolutely. We've got, 240, I think, doctor specialties, primary, secondary specialties. Some doctors have multiple specialties and, it's a very, I'll call it pure cut at what's there. So, yes, you can get interventional cardiologists, not just cardiologists. You can get, cardiovascular surgeons and neurosurgeons and, pediatric neurosurgeons and different things like that. So, yeah, you can get very, very granular, with us if that's important to your marketing campaign, in terms of the kinds of products or things that you're trying to sell. And you can also go a little bit more generic if you're selling, gowns or rubber gloves or whatever, and you kind of
Yeah.
realize that, a lot of people just need the rubber gloves for for your exams and things. And, it doesn't necessarily dictate, lots of specialization. It's just getting, programmatic digital ads, emails out, lots of different marketing opportunities, at the right sized practices and stuff. So,
Very cool. Yeah. Yeah. That's another thing. Just again, being very, I've built B2B databases before, and segmentation on the healthcare side can be very challenging. So that's good to know that you guys have over 200 ways to segment those kind of specialties. But
yeah, it's pretty common for B2B marketers, even general B2B marketers, when they really look at their customer base, that healthcare, segment when they sort of, look at SIC codes or different kinds of things that are in there, is a very important segment almost universally. Even if you're selling furniture, bathroom cleaning supplies, whatever it is, it's like, wow, our healthcare sector is really important. So we see this over and over again, and it's a growing market, and it's going to continue to grow. We have an aging population in the United States, which just means more healthcare needs as people age. Nursing home, everything. So, even if the population is declining on the younger side, the older side, this is a great market to get into, and push hard into. And it's evolving, with AI and a lot of other things. Cost structures are being pushed down to PAs and other professionals, nurse practitioners, different kinds of things. There's new models. You're going to see AI powering healthcare decision making. You can already do virtual doctor visits from your desktop and get a prescription written and things. And so, you've got pharmacies, CVS and Walgreens and things actually providing shots and healthcare, for colds and stuff like that. So it just keeps expanding and opportunities there. So, it's a very solid and growing, both from an employee standpoint, spending standpoint, growth standpoint, everything you can think of, all the metrics. This is just a great business. And to your point, it's completely recession proof. No matter how bad the economy gets, if you're sick, you go to the hospital, or you go to the doctor's office. So, it's a little bit recession proof. You may not do a lot of
Yeah.
elective surgery. Maybe you leave it for a year until your budget can afford your deductible on your eyelid tuck or something. But anyway, it's a good place to be.
Yeah. Speaking of growth, I think one sector that I've heard a lot about in terms of, demand for data and marketing dollars is in the home health sector. Do you guys cover anything that helps people that are targeting home health type, industry?
Yeah, we do have some home health contact information. That's a broad category, from people that help you cook or do different things to healthcare specific home health.
Mhm.
We're probably a little bit more in the healthcare specific home health, somebody that comes and gives you an infusion or does something versus, somebody that shows up at your house and helps cook dinner or something. But so, but we do have retirement communities. We do have nursing homes, a strong file there, growing, a huge growing area there, just within a 2-mile radius of my house here in Kansas City, there's been 4 retirement centers built, with condo like things that have skilled nursing, memory care and nursing homes. So you kind of go from just regular apartment living where you do everything yourself to, more like I'm going to go to dinner every night down in the cafeteria and not cook anymore and maybe get some help, to now I'm in a nursing home where they feed me and wheel me around, so it's kind of taking you through all the stages of life. And those seem to be popping up everywhere now, so it's good.
Absolutely. I think for those of you that tuned into our last episode with Peter, we kind of went through this business to institution philosophy, and we went through that on in terms of how businesses have different kind of driving factors than educational institutions, but it's also the same in healthcare. Can you take us through this a little bit?
Yeah, no, this is so important, and it goes beyond sort of the data aspect of things. It's how you approach your marketing campaigns. So typically people make a marketing campaign and maybe they make a couple of versions, but they tend to be the same slice of the same thing with some different pictures or whatever when they're sort of promoting out into the business community. But when you're approaching healthcare, there's different motivations to why you want to buy something. And so if you really want to resonate with, I'm just talking more right now, obviously, as a more generalized B2B play here. Obviously, if you're selling, a knee implant to an orthopedic surgeon, you kind of you've got your own marketing, specifically for that. And so, that's a little bit different, and we can kind of get into that a little bit more. But on the B2B side, if you want to get more B2B business, you have to realize that doctors, hospitals, I mean, they're mission driven. They're not necessarily profit driven. They clearly make a lot of money, but this is a calling, and the more you can make your marketing material specific to not ROI and all these other kinds of things that a business cares about, but more about helping people get better, improve lives, do these different things. We had a mat company that we used to work with that sold, like, as you came into the building, and they just changed the graphics on some of the mats to, say words that were more healthcare, motivation, and they got like a twofold increase in orders. It just it resonated with the audience that they were sending it to in the healthcare when they saw the catalog and said, this is a group that has products that are relevant to me versus just a B2B type of product. So, insurance pays for a lot of things. So the price sensitivity is not as great as, got to come in under budget on the things. We've already talked about the recession resistance. When we say politically influenced, it's just the healthcare, arena is kind of sort of thought as a broader part of the community, your local hospitals, your different things. There's plenty of private nursing homes, private things. So I'm not trying to say there's no financial influence, but there's lots of rules, healthcare reimbursement rules, different kinds of politically influenced things. And a lot of this does work a little bit more in certain communities, like a monopoly, a single hospital system or something is kind of, is where you're going. So there's lots of regulatory and different things that go around that. But really it's about sort of how you approach, these markets that's so critical, to try to take a little bit different spin. The imagery that you use in your emails, put doctors in there, nurses in there instead of a business person. When you're sending an ad in and it's a business executive sitting across a board table pointing to some sort of thing, that's not what, show a nurse walking into a patient's room or something. You kind of want to build a little bit of relevance so that people feel like, your product was designed or meant, for this use case and what this happens. And so we work with a lot of people there, and, we have lots of services to help we're not an ad agency, so we don't really compete with ad agencies on putting that, but it's just something you should point to them. But we do the sending. We'll send emails, send digital ads, different things, because there's a specialized way you've got to do that. And a lot of the ad agencies utilize us to do that because it's got to be done the right way or you get blacklisted and things like that.
You were mentioning blacklisting just a moment ago, and just recently there's been a tremendous amount of ransomware with hospitals. And so these organizations are literally adopting federal type security systems, right? This slide around your email approach, I don't think could be more important, right?
No, it's exactly right. There's been some really very public things of hospital systems shut down for multiple days with, their systems completely locked out and everything. So the cyber issue is real, and it's taken very seriously, across all the healthcare institutions, not only the ransomware, but of course, hacking and getting people's medical records or things like that, has got, huge, implications. And so there's a lot of email rules that are needed. We could do an entire show just on this, but, how you send them, what kinds of, identifications and things, for your domain and your domain authority and different things, and being very deliberate and careful about the volume that you're sending in and how you're contacting people and what the message is. Nope, I wouldn't put free in and things like that, and how relevant it is to what there is. You can still be very effective with email marketing in the healthcare sector, but it has to be done right. And, by the way, Google does control a lot of the corporate email addresses, certainly in education and healthcare. So it's not a Gmail, it's still, your corporate address or whatever in education edu or something. But when Google gets wind that you're doing something wrong, you can cause a universal blacklisting across all those various domains. So anyway, the pain can be turned up pretty significantly very quickly if you don't really adhere to the rules and do things right. But if you do things right, you can still get in there. And of course, programmatic digital is kind of one of the new areas too, because that's more the things that you read, the Wall Street Journal of this, where your ads are sort of popping up, for the people that it's intended for. So, yeah.
So your data is helpful for this issue and your services are helpful for this issue, correct?
Yeah. I think there's a couple of different components. There's the sending protocols and making sure that the way your email is constructed and the DKIM and there's all these different kinds of things. I don't want to get too geeky into it because most of the people won't know what it means, but there are certain codes and things that you send to the receiving end that says, I'm a real valid person. I'm in the US. I've got a good reputation. Google can kind of vouch for us, if you will, or whatever. And that helps them know that you're not a spammer from somewhere else. That's number one. Number two, there's the message that you send and making sure you're not stepping into the spam trap where they have spam filters that are looking at things and saying, okay, this is just a piece of ad mail that they want, and they just filter it out automatically and they never see it. So, that's the don't say free, but put some things in, make it relevant, make the right pictures and the different things. And then of course there's the email itself and not having a lot of bad email addresses. Because if you get a high bounce rate of people that aren't there, that flags you as a problem and you get in trouble there too. So high quality emails, the right message sent the right way, can work.
So I could buy the emails from MCH and then I could have MCH do outbound email campaigns to these institutions. Is that correct?
Yes. And we certainly send the data out to people. Will have sometimes their ad agencies or other places, send the emails. I would caution listeners that are using CRM systems like HubSpot and even the marketing, they want double opt-in kind of customer communications through HubSpot and Salesforce. And if you do marketing through them with a pure marketing file, they tend to get, pretty itchy with you, but so it's a little bit more difficult. So you probably want to do some of that stuff outside of the platforms with another vendor. There are some very good, we work with a lot of ad agencies and some of them do a very good job, but some of them only have one or two healthcare clients and they realize it would be smarter if we just handled the deployment of all of this. They'll do the creative. We'll work with them a little bit and then have us do the deployment, so that it goes well. So yeah.
Great. Okay. Let's talk about this piece of the puzzle, right? Person plus place, the link that most data misses. How do you guys solve this problem?
Yeah. So, the NPI file, for people that aren't familiar with this, that's the National Provider Index. So pretty much a hospital, a doctor's office, a doctor, nurse, anybody that's doing any kind of care on a person has to have an identifier that goes into their billing records for insurance reimbursement and a lot of these other things. And so the NPI system was a way for them to register. So that's available out there. But it's pretty raw. It doesn't have their email address. It doesn't have a lot of their specialty information necessarily. And it's got, my dad had a prescriber number all the way up to when he died at 96 years old, but he wasn't practicing for a long time. He would write me prescriptions when I had a cold, but, so there's a lot of people on that aren't really aren't really worthy of sort of marketing materials to, out there. So there's a lot of extra work if you want to take something like that and actually turn it into really useful data. Part of it is linkages. Where does somebody work? Do they work for a hospital? Do they work for a group practice? Do they part of a surgery center? And of course, that can be multiple answers. One of my best friends here in Kansas City is an orthopedic surgeon. He has a surgery center. He works at multiple hospitals. He does, different things. And so you're a provider at different locations. There's some duplication. So the way you structure the database to normalize it, where you have the contact name in once, and then you have organizations and you link the person to an organization, and one person can maybe be linked to multiple organizations. And of course, an organization can be linked to multiple people. So there's a little bit of a complex database structure, but it makes for a much cleaner environment than if you just attach all the doctors to everything and then you build huge numbers and you got lots of duplication. And then you get doctors getting multiple messages that you're sending out. And this is what starts to cause the problem, right? They may have the same email address and they're on 7 different institutions. So now all of a sudden your email comes in 7 different times. And then they're like, Jesus, they unsubscribe and they complain about you and then you get blacklisted. So anyway, there's a lot to this, but in terms of just understanding the structure, and what corporate entity might own a hospital, a nursing home, a couple of surgery centers, a hospice, an urgent care. And then you've got all the doctors that go for their nurses, different things. And so, yeah, it's, it's tricky. And then you've got email coverage that has to go on there. sort of building a truly relational database. And we host a lot of this in the cloud for our customers with custom pulls and Azure builds that gets updated weekly. So they have access to the most current and, up to date information when they're ready to use it. That's specific to what they're interested in. If you're only interested in, orthopedic surgeons or something, we'll pull a database of all the orthopedic surgeons and the various places they work and do things, and we can stand it up there. And then you have a kind of comprehensive active database of the areas that you're interested in that you can utilize to do lots of different things. And, we haven't
Yeah.
really talked about AI, but, you power this all with AI now, and you kind of opens up lots of new opportunities. But
Yeah, and those linkages just don't exist in general B2B databases as well. Like that's a very specialty type data set and extremely valuable if you're selling into the market. Can you tell us a little bit about the different markets in healthcare?
yeah, I mean, obviously, if you think about it, the hospital market, there's like 7,000 hospitals across the US. They're huge. One of my good friends here in Kansas City, Julie Quirin, is the CEO of St. Luke's Health System. St. Luke's is like $4 billion. Yet not many people would be able to tell you who's the CEO there, but yet all the big dog CEOs of big companies, Sprint and this, and like they're on TV and they're on the Wall Street things, and Squawk Box and all these other kinds of things, and you kind of get a name of it. But these massive organizations that have thousands of employees and do all these things somewhat kind of fly under the radar screen. It just is incredible, but the spending is just staggering. So, and then you look, you kind of go down in size, but they're very specialized, things like nursing homes, very different products, what a nursing home might need in terms of the beds and sitting people up and wheelchairs and cranes to move people and different things, and to physicians' offices, which is sort of more come and go and a churn, so you've got lobbies with furniture and magazines and examining rooms and lots of disposable products and things. So yeah, there are a lot of different kinds of markets. And then, is the doctor working for a corporation or for themselves? Are they a private practice, or are they part of the hospital ecosystem, been hired by a health system, if you will, and work for the health system directly? And that sort of dictates a lot of things. So there's just a lot of different pieces to the puzzle, if you will.
And I'm assuming all that segmentation is available for users against your data.
Yeah. Yeah. Right.
Amazing. All right. Well, maybe we can just again talk about the different delivery mechanisms for data as well as commercial models. Kind of gotten to the end of our show today, but if anyone is interested in acquiring data from MCH around healthcare, how can they do it? What are your different commercial models? Maybe just walk us through that really quickly.
Yeah, sure. I mean, we have a 24/7, 365 portal called List Builder, which people can go run, slice and dice the market any way they want and run and pull counts. And you can buy it directly and put it in. You can get updates if you want, or we have APIs that feed people. We host, private cloud databases, which are available 24/7, which is just your selectivity. And that gets updated every week. So that feeds CRM systems and different kinds of things. John and I have talked about some joint ventures within AI, because healthcare has some massive data sets. And I know, one of the areas that you guys specialize in particular is, your back end kind of database architecture is unique in that it's kind of been designed to handle, just absolutely staggering file sizes. And so when you think of, for example, Medicaid, Medicare statistics files, it's every procedure ever performed on any type of person, through the healthcare system. So it's trillions of records, kind of literally, and it's just crazy size. And it kind of requires specialized approach. And so, there's opportunities to sort of build unique custom build outs and things like that. Some of the areas that we've been sort of playing, but we're a very flexible company. We work with lots of different companies on different need analysis. So it's not a one size fits all model for us. And, we're open to hearing what it is you want to do with the data, and then try to sort of determine, where that all fits into different, different sides. But, we are not, there are some bigger players than us that have more robust solutions, like I mentioned the Mack truck or whatever. We sometimes, I jokingly say, we're more like the Costco. We're the products that sell the most at a kind of an affordable cost. It's a high quality data, and we have a lot of data, but in the big scheme of things, there's certainly a lot more out there too. But you may or may not necessarily need that, and what you may just need is a great campaign executed properly. And I think that's something we do extremely well. And if you need something on the higher end, we may be able to connect it all together and make it happen. But of course, the price does
Yeah.
go up. So yeah.
Well, we're very excited to have you on the data exchange and be partnering with you to build some of these bespoke products that require massive amounts of data. And so, like Peter said, if you need a product that is unique and requires both the combination of these healthcare data sets and stitching together of other larger files like Medicare, Medicaid, et cetera, definitely come to speak with us. And if you're not selling into the healthcare vertical, as you saw earlier today, it is a huge GDP, part of our GDP in the United States. It is a place where if you put a little bit of effort, you can get a lot of return. And there isn't anyone better than Peter and the MCH team to help guide you into that process. I mean, over 50 years in healthcare, over 100 years in education. Peter and the team are experts at selling to institutions. So we really appreciate you here joining us again for the second time today, Peter, and look forward to this journey together.
Thank you. Thanks for having me.